everyone.
Hi.
So lots of you guys commented on our videos about asking about the fee we have to pay for our medicine training. Just start the video with answering that question. So you don't have to pay anything while you're doing the medicine training. Yes, you have to pay a little bit of fees to the college, but you are getting paid for every minute you work as a resident doctor in some training program. So you don't have to worry about any fee. So that's all. You are getting paid while you are doing training. And the second question you guys asked, like why we always mention about medicine training, Arushi will answer that for you.
So, yeah, we talk about medicine training because both of us enjoy medicine, and that's what we're doing over here and have done back in our home country. But today we will touch roughly about other specialities and how to enter into those specialities or how much time it takes. Let's start with like a surgical specialty, for example, gynecology.
Yeah.
Yeah.
So if you want to get into gynae, uh, I'll compare it with medicine. In medicine, if you are working for 1 year, and there are like really good chances of getting into medicine training, like up to if you are sitting in an interview, there are around 70% chances you will get into the training. But in surgical branches, you have to work in that department as a registrar for almost 3 to 4 years, and even then your chances are plus minus that whether you'll get into that training or not. So that's why everybody who gets here love to do medicine, psychiatry, and other non-surgical branches because it's relatively easier to get into their training. But yes, it's not impossible to get into surgical training. You have to have a very good CV and very good working experience in that specialty.
Yep. So especially those candidates who have done their postgraduate in a surgical field in their home country, you come here, then I think that experience will matter a little bit, plus your knowledge and the skills that you've gained. So if you come here and let's say get a job as a resident in that surgical department, let's say gender surgery, and you're working as a resident for a month or so, 1 year or so, and then you step up to become a registrar, and eventually over 2 to 3 years, if the rest of your team feels you're good enough, then you apply for the surgical training, and there are chances that you will get in. So I think people who have done their training back home in the surgical field and they're really determined to come to Australia, go for it. Yeah.
So basically, a shortcut is if you want to do medicine, it's really difficult to get into India. So you come to Australia, you start your medicine training and become a specialist here. If you want to do surgery, you just stay in India, do your surgical training there because it's really competitive here and you have to have a very, very great willpower to get into surgical training because sometimes you might be shaken with that waiting time and you are working as a junior doctor waiting for your training and sometimes it's never the part of the plan. So you just keep on working like that and ultimately you end up becoming a GP. That's all. With a specialist interest in that field like gynae or surgery. So that's a different route if you want to. I don't want to go into that now. So yeah.
Yeah. Now that we're talking about GP is a wonderful branch, but then you should be wanting to do it. You should never pick up a branch just because, oh, I didn't get A or B, so I'm just going to go for C when I don't know anything about C. So just what we're trying to say is in order to avoid that, we would suggest taking the safer route. But again, it's completely up to you.
Yeah. So basically, what is GP? I'll tell you a little bit about it. GP is a family medicine doctor here. So they are the first point of contact for the patient. So if a person gets sick, any fever, anything they are bothered about, so they'll have to go to a GP first before going to a specialist because they can't go to the specialist directly. Unless it's an emergency, then they go to the emergency without going to the GP. So GP is their family doctor who will treat every patient, and if the patient is too complicated, they can send the referral to a specialty into an bigger hospital. So that's a GP. Now, once you're a GP specialist and you're working as a GP, some GPs have specialist interest in eye or skin, aesthetic medicine, geriatric, palliative medicine, so different specialties, so that kind of patients are always stick to you if you are good enough. So that's your extra skill as a GP you can gain. So that's a good idea.
All right, so we have spoken a bit about surgery, ops, and gynecology, GP. Now, a lot of people are interested in psychiatry. So, psychiatry is again not that competitive to enter into, but I think recently it started becoming a bit more difficult. Again, the rule is the same, how much experience you have working within psychiatry and how you perform in your interviews. But I don't think it would be as difficult as a surgical field. So I think if you have worked in Australia for 12 to 18 months, most likely it should be easy to get into this specialty. Yeah.
Yeah. So if you guys have any other questions, you comment below. We'll try to answer that, or we can make a video as always. So see you guys. All the best. Bye.